Welcome back to Relentless, guys. I'm so excited to have this episode. Thank you for coming back with us if you've heard us before. If this is your first time, thank you so much for investing the time to be here. I hope that you find valuable information that will help you find strength in your physical, mental, and emotional aspects of life. That's what all of this is about. So if you walk away with one piece of information that makes you better and healthier, that is going to be an accomplishment in my eyes. So today's topic isn't as flashy maybe or as right off the bat you don't think, well, that's not that interesting. We're going to talk about holistic dentistry. And what makes that interesting is I understand that people are on the search for health. When you're sick, when you're in pain, and you're not finding answers, you're desperate to find help. And the whole concept of this podcast and the relentless mindset is that you don't stop looking, because there is an answer to what your body is communicating to you. And one of those avenues that is very rarely looked at as a global aspect of our health is our oral hygiene and our oral health. So I have with me today two guests. This is our first time having two guests on the podcast. I have Dr. Eric and Dr. John with Kempter Dentistry. Thank you for being here.
Thank you for having us.
Yeah. Absolutely. So before we jump into some, again, hot topics, because anytime you bring up health, there's going to be some hot buttons we could push. On a personal level, just tell me a little bit about you, your family, how long you've been in business.
Oh, well, I'll defer to the older gentleman over here.
So you can tell this is going to be a fun podcast.
We own Kempter Holistic Dentistry, which is up in Concord, North Carolina. We'll be shortly expanding outside of our region, heading towards other areas, including South Charlotte and other areas of North Carolina. I'm a 2008 graduate from UNC. Went to NC State for undergrad. I have to always point that out to people as a sports fan, but loved both colleges and got out. And at the time, I got out in 2008. In 2009, our grandfather, John, my dad's dad, got diagnosed with Alzheimer's. And through that, I was just, in 4 years at that point in dentistry, and had spent 8 years in really looking towards science and medicine. And it didn't sit well with me. It was like, okay, well, if this is all genetic, that means that I'm going to get Alzheimer's. And, you're at the point in your career where I just got out into the real world. I was working for a bigger practice, a general dental practice, and there it was, and right in front of me was put my grandfather getting sick and asking questions. And so on the short story there, through that I found out about that Mercury is highly correlated with Alzheimer's, and we can get into that in some detail later if you'd like. And in my research, I realized that my own field was surrounded by this. And so luckily, mentors were put in place within that first 2 to 3 year period. And in 2011, I opened Kempter Family Dentistry at the time. And then Eric got out of school in 2014 at UNC also. I'll let him talk, but throw that in. And then he quickly, within a year, joined the practice, and we rebranded completely as a holistic dental practice. We can get into what that means. And so from that, we were able to start looking at the whole body, as you said, and I think that's really a key point. And we've been really blessed that whatever it is now, 2019, I can't believe to say that, that we're here and we're thriving and really being able to help people look at not just how to fill holes and how to, solve pain, but to really look at the cause. Mm-hmm. And so, and on that plug early, I'm honored that, for us to go further, the big step was teaming up with my brother, and we're in the process of teaming up with some other people that are like-minded, and we're really our callings to be able to help as many people as we can.
And you're not just a practitioner treating people, you actually have a family that you embody all of this thought process in. So How many children do you have?
Yep. So first, it's the rock of my family, my wife. we moved to, we're from Long Island. We moved to Charlotte with the first wave of Yankees, I call it, in the mid '90s, and so I'm 38. I met Shannon at 16. I also met my second parents, my in-laws, Tom and Ann. So we're, as I tell everybody, I'm the guy that you'll never meet somebody who has had more male mentors and even mentors in general, between just grandparents and fathers. And so sure enough, I meet Shannon early, and we go to NC State together. She goes to Carolina with a ring on her finger, as Tom put it back then, and she's not going with you without that. And we were already planning on getting married. And anyhow, I have 4 children. I have 3 girls. Felicia's 10, Samantha's 7, Alexandria's 4, and then Jackson, John Jr. is 23 months now, almost 23 months.
Awesome. Keeps you busy.
Oh yeah.
We'll get to some more. We'll get to some more personal things in the end if we have time for it. But I love to hear those stories. And Dr. Eric, your family.
My family, so I have my wonderful wife, Leela, and I have 2 daughters. I have Isla, who's almost 3 years old. She'll be 3 in March. And then I have a 7-month-old, Elena. They definitely keep us busy at home.
Yes.
They are quite rambunctious kids, even the 7-month-old at this time. So like,
I don't know where he gets that energy.
I have no idea whatsoever. And we have a sister between us, but I'm the youngest, so of course I'm the amped up one all the time. But it falls into even how we practice and everything. I'm very passionate about what we do here. Just kind of reiterating like what my brother said here. I went to NC State for undergrad as well. I did have a stop off in UNC Charlotte to get an extra degree, and I did get into dental school at Carolina. And during my time there, even how we got even into this point here is when our grandfather got sick, John had kind of reached out to me. I was learning some things in dental school and had relayed to him that something just didn't seem right, especially with a degree in chemistry, just with Mercury coming up, some other topics in terms of materials. And he, encouraged me to come to a meeting. We'll talk about it, I'm sure, going forward, but it's the IAOMT, the Biologic Dental Association, essentially. And he took me to a meeting, and pretty much the rest is history. He took me on in his practice. I worked in a general practice for a year, and I was blessed to have my brother hire me on and to take the risk to bring me in. And ever since then, I love what we do in our practice. It's so much different than being in a practice where you're just doing the grind every day. We actually get to see people get healthy. And the one thing that we see all the time is people coming frustrated with, I'm just so sick of going to the dentist and always having problems. And I feel like now with what we have established here, and I know we're going to get into it more, but we actually can give people an answer, or at least give them a path to get to health. So so working with my brother is great. I get that question all the time, is what's it like working with your brother? I think, and you can tell me if I'm wrong here, but I think we have a great relationship. John's been my best friend, since high school. He was a little bit picking on me as a kid, but since we got a little older, we've been best friends ever since then. So it's like working with a best friend. And I do have to mention our father does work with us as well. He works more in the behind the scenes thing. So it's a family practice.
He keeps us in business.
Yeah, he does.
I'm sure that is true.
So it's nice to work with your family. If you had asked me when I was 16 if I would ever work with both my brother and my father, I probably would have laughed at you. But here we are, 2019. I work with my dad and my brother, so it's great.
And I point out the family aspect because we're going to get into some topics that it can agitate some people. And I like to point out that you're not just a practitioner doing things. You have children that you are as equally convinced this is the best thing for them as your patients. And that is a real important thing for me to point out, is you have learned, you have educated yourself. You would not do something to your children you wouldn't do for a client. Or
I get that question a lot, actually, from a lot of, we see a lot of kids at our practice, and when the question comes up about what would you do for your kid, every time it's always, whatever I would do here, I would 100% do for my children.
Exactly.
We don't do things in our practice that we wouldn't, and I know John says the same thing, if I wouldn't put it in my mother's mouth or my dad's, or I wouldn't do a certain restoration for my sister, it's not happening for my
I went last, I guess it was 2 years ago, out to Seattle, just a small point, to a biomechanics class with a group called the Coy Center. And the whole reason I wanted to go was I had, it happens to us. I've got kids. We have, no matter how holistic we're trying to live, they go to, grandma and grandpa's, I'll throw them under the bus, and next thing you know, they're getting Skittles, and so you do what you can, and so anyhow, they've had some dental needs even in their young life, and so when I went out to this class, my goal was, I came back and I said to Eric, I said, look, I've picked up now what's the best biologically in terms of materials and structurally. How do we get the best of every world for longevity's sake, which the ultimate goal is we want you to be healthy. We don't want you to need us. I mean, opposite of what's out there.
Love is the constant search for the best choice possible.
Yeah.
So scaling it back to, some people will probably be thinking a dentist is a dentist is a dentist.
Right.
Well, would you think a lawyer is a lawyer is a lawyer? No.
Yeah.
And a massage therapist, they're different. So what is holistic dentistry?
I get that question fairly often, especially from fellow colleagues I went to school with. I think the best way that I would probably put it is we look at your mouth as part of your whole body, and it's treating your mouth with the whole body health in mind, while incorporating materials that are biologically sound and that are non-toxic for your body. And I know John pointed it just a second ago, but stuff that actually lasts, something that is you can maintain. The idea is, when we see you in our practice, when we see you we get through your treatment plan, the idea is, we don't want to do dentistry on you.
Right.
You shouldn't be in this constant cycle of having bad things happening, because we want to get to the root cause of every problem. We want to get down to, whenever people come in, they say, I've had a lot of cavities or I've had a lot of crowns. I always ask myself, and I'll ask them, why? And a lot of people are taken aback, and
That's
say,
just how it is.
Nobody's ever asked me that.
Right.
It's just somebody has said I needed it, and that's what I did. We tend to ask ourselves, why is this happening? Because if we eliminate that cause, then logically the problem's not going to be there anymore.
Right. Yeah. So what is the difference in holistic then versus your traditional?
Well, Sandra, I think it's simple. There's complex ways to look at it.
Sure.
The simple way to explain it, we are generalists. So we in terms of our practice setup, we do the same modalities of treatment. We have a hygiene department. We happen to call it dental fitness because we're coaches before we are cleaners of teeth. Now, we do that, and we have a traditional practice in the sense of everything from doing biologic restorations all the way to crowns and cosmetics, and we even have whitening that is alternative options from what's out there that has chemicals. And I'm careful because, you really think about it, if you're splitting hairs, there's nothing in dentistry that's non-toxic. Right. So the biggest difference to me between holistic dentistry and traditional, it's simple. I don't want to do dentistry. Right. When we need to, we want to do it in the most minimal perspective. We want to look at prevention first, and I always go here, I'll get on my soapbox early. Unfortunately, in the United States of America, we have the #1 emergency medical system in the world. Out of all of the industrialized nations, though, we are 47 out of 47 for prevention. Sad. And so here we are, and dentistry is right there with it. So, I'm careful because, there are so many incredible traditional general dentists out there that are not using materials that, in my opinion, shouldn't be used. In my opinion. And there's lots of controversy, I'll say that, in the dental field about what's legal and what's not. And where I go is, for my patients, what they want is this. And they want the least. They want what's going to be inert in the body, not affect the body. So, we love our traditional dentists, but what we say is they're commodity driven, most of them. They're looking at how many crowns they're going to do in a month, and just to be direct. And we're looking at how do we get our people healthy. Right. And the quick story I'll tell you on that is I had a rep come in. I'm at this point the back end business guy. Eric's getting into that, but that's been my side. And so the reps come in, they want to talk to me. And this rep sells chemicals. We'll just say that. He's a product guy. And I won't even allude to anything else beyond that. And he comes up to me and he says, Doc, you must not be checking people for periodontal disease and, for their health, because you're not buying any of this and this antibiotic or this or that. I let him finish, and I just said, his name's not Jimmy, but I'll say Jimmy. Reality is my people don't need that. my people are healthy. And so we're looking at it on that level, on an alternative. But I also want to point, we're not different in the sense of dentistry itself. One of the other things we do is we do everything that we can in a same visit. So we like even our crowns, hit the microphone here, but even with our crowns, what we're doing is we're looking at ways to deliver them that day through computers. So, and then Eric in a little while can get into ozone. That's another big factor.
So in every industry, you're going to have, like with massage therapy, body work, you're going to have people that get the same certification, have the same taglines, have the same visible effort that you have, but they're not the same. So I know there's going to be holistic named practitioners and holistic named offices, but again, you're not going to have the same level of care.
I always encourage people, just do your research. Look at go to the office, see what they're offering, do your own research at home, and go with your gut. We pride ourselves on being holistic, and there's guys out there that kind of dabble, and it's, again,
we'll get into the accreditation side.
Right. So
that's important.
So the organization I alluded to earlier is the IAOMT. It's the International Academy of Oral Medicine and Toxicology. So if you're going for safe removal of amalgam restorations, you want to find somebody who is at least SMART certified. SMART is Safe Mercury Amalgam Removal Technique. That says that they're certified to actually take out the amalgam fillings safely. They have the proper.
Which the tagline for the IAOMT is know the research.
Right.
So inevitably, I get into discussions with the traditional dentists regularly about this, and we love them yet again. And so to educate, I like to point to the literature that we have, which is different than what we've heard in school, and different, to tell you, than what's been pushed by the ADA, because the ADA supports mercury amalgam and fluoride and several other things that are, on the IOMT level, we've researched are not ideal for you. So I just figured to throw that in.
Right. So yeah, you just, if you're wondering if you're looking for a holistic dentist in your area, my suggestion would be to go to the IAOMT.org. They have a directory, and you can find somebody who's actually accredited to do holistic and biologic dentistry and to safely remove those mercury amalgam restorations. So you just need to be careful, because again, there are people that do it in advertisement only, and they do some things that are holistic, but they're still doing things, a lot of things traditionally. And again, it's not that they're bad dentists. It's just it's a mindset thing, and it's a how you're actually practicing. Like you said, everybody comes out of school with the same certification. It's about how you interpret that certification and how you actually practice every day.
I think the key is ask questions.
Right.
Like, and don't be afraid, like Dr. Eric's mentioning, when you talk to the new patient coordinator, get a feel for whether or not they'll let you come in for a tour, or do they have something on their website that explains about what they do and how they do it. I mean, I think that's crucial.
Yeah, and that's a good point to remind everyone. In every aspect of health, we should be doing this. Just because someone has a certain acronym behind their name or a degree, we can't just take their word for it. You have to be relentless in your effort for your own health, because as I say all the time, everyone is a snowflake. Not everyone needs the same thing, and not everyone is going to respond to the same treatment or the same practitioner. And on the flip side, none of us are demeaning medicine as a whole, but if there is a better option, I would think everyone would want to know that better option. And that's what we're here for, is to just show the better option, the less harmful, and to give you that choice.
You're exactly right with the option side of things, and I say it all the time in our practice. My job as a practitioner is not only to perform the work on you, but my job is to inform you, to give you all of the information so that you can make an informed decision about your care. Informed consent's serious, and I think a lot of practitioners have kind of lost their way on that side of things, where they're kind of dictating treatment to patients
100%.
when in reality the patient. We're in America. You have the freedom to make choice about your health care, and you should make your own informed choice on it. And if you don't get a lot of information, if a practitioner says, "Hey, you need this, 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 and this," the first question out of your mouth should be, "Why?"
Right.
Give me the evidence. We take pictures, we take X-rays, we go through everything with people right with them, because we want people to see what's in their mouth, and we want to show them that, hey, this is the situation here. If you choose to do something, here's what we would recommend. If you choose not to, That's perfectly up to you, and here's the consequences if you choose not to do. Here's what can happen. But by no means do we ever hold a gun to somebody's head and say you have to do this crown here. It's here's the information. If you choose to make your choice,
that is done a lot. I hear it all the time.
That's the expert model. That's the expert model. Wear the white coat. You're just the patient. And the comment on that, throwing in what Dr. Eric's saying, the older generations, the baby boomers and that crowd, unfortunately, they grew up with a different scenario with a level of trust with doctors. We went off the rails. And so I think it's important to know that, I have to coach people. Like, doctor in Latin is teacher, like Dr. Eric was saying. Our number one goal is to teach people. So we spend the time to ask the questions. And once you do, you realize that people have such a level of trust. And unfortunately, that trust has been eroded. And it doesn't mean that we're going to be disrespectful. But I will say this, I've had personal experiences with going into pediatricians' offices, I should say, because it's been multiple. I've been fired by multiple pediatricians. Can't help it. And on top of it, it's because I ask questions. And when you do, right to someone's soul whether or not they're willing to be a teacher or whether it's truly about commodity and being an expert. We always define it as, in our world, level 1, level 2, level 3, level 4. And the easiest way to explain it, level 1 and level 2 dentists, those are emergency dentists, and they're people that probably 90% of them out there, and they're really just focused on the short term. And then you have us in the world of 3 and 4, where we're whole body, we're really looking at, again, minimization.
And on an individual aspect, this is a great time to remind everyone, a lot of times people come to you and they are at their wit's end. And I always like to remind people and give them this freedom of thought. When you're in extreme pain, and I've had 2 oral surgeries in 1 month, so I know what this feels like, especially around the face and in the mouth. When you have pain like that, you feel insane. You feel, it's just, I can't even describe it. So when you're in that predicament, that is not a time just to say yes and sign on the dotted line. You need to stop and take a moment, which means you need someone in your corner, if it's a family member, and educate them and say, listen, please come with me and help me think this through. Yeah. And that's a big point I think we have to remind people is when you are in those times of pain and the hierarchy of pain takes over your body and mind.
Yeah, especially tooth pain.
Tooth pain is crazy. And it's just one of those times where you've got to, as much as you want to just say yes and go, take a step back, get somebody to help you, come with you, and make the right choice.
Regardless of what they tell you, there's always a way that you can punt the football, even if you're in extreme pain. There's ways to do it, whether it's holistically or even with some traditional medicine methods, whether it's an antibiotic or whether it's just some temporary relief on things. You can take time to get informed and make a proper decision. That you can get that pain level down, regardless of what anybody says to you. There's always a way to do it. So
getting into some more of those different modalities or treatment styles you guys use would be the ozone therapy.
Right.
So let's jump into that topic.
That was a big practice changer for us, actually. Yeah. So we implemented ozone about 1.5 years ago. Probably about 1.5 years ago. So for those that aren't familiar with ozone has been around since the early 1900s. They actually used to disinfect surgical suites with it. Essentially, ozone is oxygen is O2, ozone is O3, so it's got an extra oxygen on it. And that extra oxygen molecule actually can do a lot of wonderful things in your body, and especially for us in dentistry. We use them in just about every procedure, I would say. We make ozone water. We actually pump those through our dental line. So essentially, ozone is antibacterial, antifungal, antiviral, and incredibly anti-inflammatory. So for our purposes here, for instance, if we do a cavity, if we're filling a cavity or we're prepping a tooth for a cavity, when we're finished, most practitioners will scrape the tooth and see if it's nice and hard tooth structure. That's usually indicative of whether the cavity's gone or not. Realistically, though, there's microscopic bacteria that's still inside that tooth. So what the ozone does for us is it will actually kill off the rest of that bacteria in that cavity prep. And one of the other things we found that it does is inside the tooth, you have these things called dentin tubules, and essentially, without getting too deep into it,
you should have brought pictures.
Right, I should have brought some pictures. Without getting too deep,
think of tunnels in the teeth.
There are tunnels in the teeth. That's how you feel sensation and sensitivity and pain. It's the fluid inside of there moving. Again, I'm not going to get too deep into it, but essentially, the ozone will cut off those tubules so that the pain signal can't get sent, or the sensitivity signal. So when we put the ozone on there right before we put the filling, it has dropped our rate of sensitivity after fillings. I don't know how many people you've had come back for that. It's been minimal. It's been less.
Yeah, he beat me to it. It's been in my 10 years of doing this in dentistry. The last two, it's exponentially less. And it's because of inflammation control and sensitivity control. Now, there's other forms of it. Get into toothpaste. I mean, you know,
right. So we have so there's other forms that we use it, but even other procedures we started using them in extractions. We after we take a tooth out, we'll pump the gas into the area where the tooth was, and we also inject it into the tissues. And a lot of the anti-inflammatory characteristics comes from developing natural nitric oxide in your tissues, which opens up the blood vessels and decreases that inflammation. And Dr. John does a lot of surgery, especially implant surgery. He's utilized it with that, but we've noticed our healing times in our extraction patients and our implant patients has dropped significantly.
Well, and throwing in too, it's not only the healing time and pain. Right. So I'm careful still. I do, as Eric said, most at this point of the implants in the practice, and we use a non-metal zirconia implant in most cases, and also a titanium too that is biocompatible, and I can get into details on that if we need to, or talk if anyone ever wanted to, call my office. The main thing to know, though, is I'll give you 3 years ago when I did a single implant placement with the Fabergé egg technique that we have. Even with that, it was a 3 to 4 day immune response. And reason being, it's inflammation. It's the natural inflammatory cascade. We can knock that down and lower the time between and take it down to about a day. And so I tell patients, now I'm like, look, Arnica montana, which is a great, natural anti-inflammatory, take that like you would ibuprofen sublingually 3 times a day. I very, very rarely have where I consider giving someone a pain med unless they're very concerned. I mean, I'm not against it, but it's really just not needed. And it slows the healing, back to that. And then antibiotics. This is my favorite topic. I cannot tell you the last time without someone asking me for it that I've ever given an antibiotic for implant surgery. So replacement teeth, you don't need it because we handle it at the site. And so your body doesn't need to have that
medicine
assault.
Right, your gut doesn't need to have that happen.
I know. So one of the great things I want to point out is, because you have invested yourself into finding the best things for the body, it's kind of like walking into a clean house. You don't appreciate the clean house. Yeah. Mm-hmm. You walk into a messy house, it creates, domestic violence with your spouses.
Right.
So what I want to point out is, because you have invested your time, energy, resources, intellect, all of that into finding the best choices, what you're doing for people is preventing them in a lot of cases from needing the stuff that, at some point we might need those extreme painkillers, but how about we don't even need those? Yeah. Right. So what you've done now by choosing a better alternative is you have prevented your body from having those onslaughts of chemicals more to begin with. So that's a great point.
It stops it at the pass. And a big one, we talked about kids before. One of the ozone things that we can do in our office, which we're actually allowed to do, is we can do ear treatments, what we call ear insufflation. And insufflation is just pumping air into a cavity. We actually have a stethoscope that hooks up to our ozone machine. And I know John's kids have had ear infections, and we've hooked them up to it. Most people don't realize that most ear infections are not bacterial; they're actually viral. Mm-hmm. Ozone is one of the few things that can actually attack viruses and actually cut back the length of how long you're sick.
Right.
And one of the studies they did with ozone, and I'm going to try and get this correct, but I believe they had 18 kids that had antibiotic-resistant bacterial ear infections. They hooked them up on the ozone machine. They did treatments every day, twice a day, and 17 out of the 18 kids completely resolved their issues within a week. Wow. So we can actually treat people that way. Dr. John's very familiar with this because he gets very stuffy in his nose. We do sinus insufflations with it. Mm-hmm. So if you find that you're having some tooth pain in your upper upper teeth, and we determined that it's usually a sinus pressure issue. So a lot of
Explain insufflation. Sorry to jump in. Yeah, get back.
I'm using big words.
Shop talk.
Big, yeah.
Big stuff.
Put it back down in normal people terms. I'll get out of my nerd talk here. But insufflation is just pumping gas into a cavity, essentially. Yeah. So your sinus is a sinus cavity. So, for instance, when we say sinus insufflation, it's just
blowing air.
It's just blowing air into the sinuses, and it's just ozone gas that we're putting into the sinus. Typically, most people we do it in Dr. John.
Well, I'll say that what it feels like, it feels warm, and I have chronic sinusitis from as a kid. You know, we can get in deep, but it's like, you know, I'll stay off of the gut, all the different things that were wrong, and why I have allergies, vaccines, you know, throw a few plugs. But we'll stay on, okay, now I have this. How do we treat it? And I'm the guy that, you know, I've taken allergy shots. I've done, you know, everything from Flonase to Claritin. And you can hear me right now. Thank you, North Carolina, for the 70-degree weather down to the 20 and the heat being on, the heat being off. So I'm very dry right now. But that being said, as Dr. Eric explained, in the last year and a half, I've seen massive change in my cavities here, my ears and my sinuses. And it, again, you put the gas there, and immediately it feels warm. And he tells the kids, like, yeah, well, in the ears it'll feel like Pop Rocks, and it's just like this bubbly sensation. And what that is that's the oxidation of the cell wall of the bacteria or the virus, that's there. And so you can, you know, think of it this way, like the layman explanation is, you have all these options to kill things through your stomach, which bring about all sorts of problem in your body. Whereas we can treat it with something that for every human being, you don't have an allergy, which is oxygen.
No person's allergic to it because the only side products from it is water and oxygen.
Yeah, and I always joke, like, if you've seen My Big Fat Greek Wedding, you know, the guy Gus has the Windex. It's now our Windex. Like, it's like we use it for like.
So our sister jokes all the time, and it's always in John's household. It's oh, watch out, he's gonna break out the ozone oil, you know, or he's gonna go get Eric to go get the ozone.
On the ozone topic, just to, you know, take this from Sandra for a minute, can you explain about toothpaste? What do we recommend there?
So if you find that you're one of the people that's had issues getting inflammation out of your mouth, or you have a high bacterial count in your mouth, people that come in with mild periodontal disease or gingivitis, one of the great things that we have is we have a product from a company called Pure O3. They make these ozonated oils, so it takes like weeks to actually make this oil, almost a month of straight bubbling ozone into various different types of oil, whether it's olive oil, coconut oil, avocado. Each of the different oils have a different level or concentration of ozone in it, and obviously depending on your case we'll recommend a certain type. But even for kids, so if kids are getting a lot of cavities, for instance, I recommend at nighttime you actually use the ozone oil as toothpaste, and you can actually coat your floss in the ozone oil and then floss with it to get it in between your teeth. I tell people to spit out the excess. Don't rinse your mouth with water and just go to bed. And we've done this, you know, anecdotally, you know, case studies in our office. I've seen big changes with people within a week period. That inflammation's down. It's killing off the bacteria in there.
Sensitivity's down.
That's a big one.
Change with it. And, you know, and then in the morning we recommend either compounding your own toothpaste, which we have a compounding recipe on, I believe, both our Facebook page and website, and also just having a natural toothpaste, something that doesn't have fluoride and doesn't have triclosan or other chemicals, SLS, sodium lauryl sulfate, or any of the derivatives.
We could just talk about that for an hour. It's like, I don't know where to go next.
Well, we'll come back at some
We'll just
point.
keep it to, so the next thing would be talking about amalgam fillings. So you're going to have people on both sides of the topic. First, would you want to have them out? And then go into what is the best.
Okay, so to go there, mercury is the second most toxic substance on the planet. And I'm careful because the thing to say, Sandra, as Dr. Eric's alluded, we're really responsible from here to here. Sure. So everything else that I say is based on, back to research, what we know about mercury as an element that's made here on Earth, and what it does to the body. So next to plutonium, it's the second most toxic substance on the planet. Now, you have to get a little background here. I think it was 1816, don't quote me on that, but in early 1800s, the Krakow brothers from France figured out 1880s. No, it was earlier than that. But I'm sorry it had to be earlier than that, because in the 1850s. Yeah, it's okay. So in the early 1800s, the Krakow brothers from France figured out that you could take silver chips, cracked up silver, and with mercury in a mortar and pestle, you could make this amazing putty, because mercury is the only substance, only metal that will liquefy other metals while in contact. So where this was amazing is that at the time in dentistry, you know, we had, like, take the United States. Yeah, we had either dental surgeons that were pretty much 1/1000th of the population. And then there were barber dentists on the street that were, you think about where we were at the time as a society. So, you know, I look at it to start out as it was an unbelievable advantage at that time to have this material that, back to it, you know, I can mix it and then I could teach you in 5 minutes how to pack it in someone's tooth. And it actually is amazing. Because of some of the properties of the metal, it actually will even kill the bacteria. So let's take mercury out for a second. It is the most amazing dental material out there. I'll just go there. This is why dentists to this day still think that it's a great idea in certain situations to use it. And we believe that it's a great material, but there's an unfortunate, inconvenient truth about its toxicity. And there's other ways to fill teeth nowadays. Now, you have a couple things here. You have the obvious target is we shouldn't be placing them. That's the belief, really starting to be the belief of all of us.
It's also a market-driven thing. Most people don't want the silver fillings in their mouth. Yeah. They're saying, hey, can I have the tooth-colored filling?
So there's a lot of dentists that say because of what they look like, that's their reason why they don't do them anymore. But there's a huge piece to this, and that is every mercury filling is 50% or more by molecular weight mercury. It has other elements in it. When it is in compound in the tooth, it is releasing mercury gas. And to get into that, we have to worry about, you know, the mercury. This is the defense of it. Well, it's everywhere. It's in the air. It's in the water. It's in the food. Well, first off, I can hit the water and the air real quick. When it goes through the GI tract, it processes differently. I won't get into a bunch of detail there. I'll just say that you're protected by your stomach and your liver. Now,
if it doesn't have a hole in it.
That's right. That's right. It's true.
Okay, go on.
True. That's a whole nother world that's over my head. But then you have the aspect of ethyl mercury, which is the breathable mercury. This is the danger with mercury fillings on the vapor level and in the air when you think about coal power plants and all that. So in my world, though, where we separate ourselves back to holistic versus traditional, the scary comes with removal of that mercury. When there's 150 million people in the United States with metal in their mouth. The couple statements on it is only about 20% have acute problems. That's what's known. 80%, the other 80% are chronically exposed to it, and it's very difficult to claim whether or not the fillings are related.
Well, and they have the ability to detox that heavy metal out of their body. They have the proper receptors for it. The 20% don't. They have the mercury builds up in their body a lot easier than that 80%.
And that's not all, but it's really just it depends.
Relative to that 20%.
Going back to where snowflakes.
Yes. Right.
So what's the makeup of your body? How does your body respond to this?
It's the same argument as somebody who smokes for 80 years and doesn't get lung cancer. Right. There's people that are like.
Well, in the book that I'm reading on right now is on epigenetics, and you really look at back to my grandfather John. You know, our grandfather. It's like there were so many factors there, and so I don't get into that causation. It's very easy to start. What I wonder. What I know is mercury as an element is toxic to humans. In every other industry, we have precautions for this mercury. In dentistry, because of its history and because of how it just innocently for us has been a key product when we didn't have other options. I don't blame other dentists. Now but where we are in 2019 and there are other options. So it becomes two nasty topics. One is training of dentists. That's the easy target. We'll go to, unfortunately, a lot of dentists are just living in the past. I'll stop there. Second would be the more sinister one, which is because of money, because of the health clinics in the United States and the government not being able to afford to do what's needed to restore these teeth correctly, they bury it under the rug that this is an issue. And it's happened over and over, and there's been lawsuits that the IOMT lawyers have put out towards the FDA, and they've been squashed. And so back to, like I told you earlier off camera about the Serenity Prayer, and just give me the wisdom to know what I can and can't change. And so for me, I get back to educating people on the mercury as an element. And what we know is that in the tooth, to summarize, it is safer than when it's removed. I will caution everyone that when you have a mercury filling removed, that we're 3,300% above the OSHA safety limit for mercury exposure in one day if there's no safety gear involved. So when we get into safety gear, Dr. Eric can comment a little on the SMART technique, but the things that we do to capture this mercury from a occupational side. Because admittedly, I'm very concerned. My patients are a huge importance. They're my family. But as we all are, you're worried about your own health and your own hide. And when you look at dentists, we are the sickest of all medical providers as a whole. And this is because of our exposure to not just mercury, but other chemicals that we're exposed to in dentistry.
Right. You can quote Seinfeld and say, you don't know what my people have been through. And it's the dentists. We've been through a lot. No, yeah, there is a right way and a wrong way to do it. And I know he talked about the SMART technique. So what we do in our practice, the IOMT has come up with a protocol called the SMART technique that helps us safely take the mercury restorations out. The whole concept of it, and without getting too nitty gritty into it, is we need to not let it get in your body when we're taking it out. So we need to protect your mouth, your nose, your airway, your eyes, and your clothes and your body. And in doing that, what we do is we do all the removal under rubber dam, so none of it gets into your mouth. We have an oxygen mask.
Well, we also, just to throw in, I'm sorry, but for patients that can tolerate the rubber dam,
right?
The rubber dam's an umbrella. Dentists use this often. I think they put them on incorrectly 90% of the time. We're very skilled. Our assistant said, getting this where it's not claustrophobic, but also, to cover that. When we can't use it, we use a cleanup, which is a specialized suction. Yep.
And it doesn't even allow any liquid anywhere around that 360 degrees to get into your mouth. So we have situations where we do have to use that. We do put an oxygen mask on your nose, so you're breathing 100% oxygen during the procedure. So none of the mercury vapor, God forbid it ever got out from the actual drilling process, you won't be breathing it. Eye protection, I think that's a no-brainer. Obviously, there are particles that are flying in the air, microscopic particles. We do not want those getting into your eyes. The other thing that we do is we put a drape on you. So after the procedure, I sometimes like to do this when they ask, well, why are you putting this drape on me? And when I'm finished taking it out, when I'm finished safely removing the mercury, I'll show them the drape, and you see the amount of mercury splatter that's all over that drape. The biggest thing is we actually have a specialized vacuum that we put approximately 4 inches from your face, from the site, as we're removing this. Our assistants are very skilled, like John had mentioned. They're having a high-speed suction right by the tooth as we're drilling it, and they're also spraying water the entire time he or I are drilling.
Yeah, since we have the rubber dam and suction in place, we've protected your airway. You have oxygen also. So I tell my patients, we can then flood the site, which suppresses the mercury as we cut it. We cut it in large chunks. And this gets into, in dentistry, I don't know, 8 out of 10 people, Sandra, are afraid of us. And so I'll take a little aside and say, Fabergé egg means we're very concerned with how can we do this with minimizing, stress on you and the teeth, because this goes back to nerve death, and we want to be, so just to highlight that, we use a brand new, this is unfortunate where a lot of practices are cutting corners, a brand new burr or drill bit that is very thin, that is meant to not powderize this metal. And he has 5x, we have 5x, I don't remember, something like that, magnifiers, doesn't matter. So we have at least 3x, I got 5x for surgery, magnifiers, that we're looking at your tooth, I mean, it's like, this big. And so we're there safely going around, and then as one of our assistants is there working with us, they're spraying it, and it's just, as Eric said, early on when I was learning about this, you had the dental air vac on the person's chest and sitting there as you're removing. And I used to look up and see a bunch of metal in it. And I don't believe at the time we were doing a great job at capturing it even at the site. So our whole point is we have many different parts that are even beyond what is the SMART protocol. And on that, I'll say we have some mentors out there that I'll plug right now. I'll give you some names in North Carolina. We're North Carolina's way ahead. I'm just going to say that. And so fly here, come here. Charlotte's a hub airport. We're in Concord. Carl McMillan, a colleague of ours, and Cornelius, a dear friend and mentor. I mean, this is Matt Young in Hendersonville. We got Bill Virtue up in Yadkinville. Dr. Sharon Reed, who's in Clemens. She also has an associate. These people have been instrumental in the trailblazers for our field. And so they've even taken, where I'm going with that is, they've even taken it further, like where you'll see them in Tyvek suits and things that are really.
Just the mouth that's exposed.
And our reason for not going there to throw it in is we want to be men of the people, and men and ladies of the people, and that gets very costly. And so one of the topics is our fees are very standard. And so back to it, I'll say this, my personal opinion is, we've got it now above 99% of capture. So I joke with my patients, look, you're getting your mercury removed and you got less exposure than when you're breathing in North Carolina. Hang out with us for a while, you're safer. So
just going back to continue to look for the why.
Right.
And that's what we're here for, is to give you more information to try to figure out the why. The next topic I want to cover is very near and dear to me, something I deal with every day, TMJ. So how do we get TMJ? There are a myriad of reasons why, and searching for that reason is a good thing. But if anyone has had a baby and has tried to breastfeed and had latching problems and ended up finding out that your baby was tongue-tied, you will know exactly what I'm talking about. But what happens when that wasn't discovered and you become an adult? And so I don't know if you've seen this, but I've seen recently an MRI of a person talking and how much movement goes on in the jaw and in the throat with the tongue. So just think with me for a minute. This is all kind of maybe new information, but let's just say, for example, I held my shirt down and I wouldn't allow my arm to move. Well, it's not that my arm doesn't have the ability to move, it's that I'm holding my shirt down. So if your tongue is attached to the bottom of your jaw because you're tongue-tied, you don't have good mobility in your mouth. If you don't have good mobility in your mouth, you're not going to have good mobility in your neck. Everything is connected. So you guys actually help adults with tongue tie.
We do.
Which is amazing. And people never think about this. And they're taking medication on top of medication.
We help
and getting
everyone.
shots.
We'll do
Right,
everything
yes. I just think it's
adults,
amazing that the adults do. That's what I'm saying is
Yeah.
people will be searching and taking drugs for years thinking they have jaw pain when it could be a structural issue.
The biggest one that I always get is if I'm doing an exam and I see that there's a tongue tie, and there's four classes of tongue ties. We'll get into it in a little bit, I'm sure. But if I see that tongue tie, I start asking them questions. Hey, do you get a lot of tension in your upper shoulders and neck area? Do you feel a lot of jaw tightness? When you talk, and if you talk too fast, do you stumble your words? And people are usually taken aback, like, is this guy like reading my mind?
Right.
No, these are all symptoms of a tongue tie, and the things that we see when a tongue tie is not resolved as an infant. These are the consequences we see as an adult. And I'm going to plug our other business that we have here. Preferred Sleep Solutions is a practice that specializes in dental sleep devices. I know, John, you can comment on this in terms of the number of people you see that.
Oh, it's a massive amount. I mean, I'll say, Sandra, there's so many. What blows my mind about what God's done for us, like in terms of putting things in front of us. You ask and you receive, and if you're really searching, and I have severe sleep apnea, and personally, and I'm not the lightest of guys, but I'm not also morbidly obese, which we connotate to people with severe sleep apnea. And actually, it's anatomy, and I'm in the process of getting my board license in dental sleep treatment, along with a dear friend of mine, Rick Van Gerp, who is in South Charlotte. Who I'll go ahead and you'll be the first to hear this. It'll be a little while from now, so by then it'll be done. But Preferred Sleep Solutions is in the process of merging with a company called Carolina Sleep Solutions, and the reason is Rick and I and Eric are really the only providers out there that are looking at airway as holistically part of that's where this genesis came. And my own personal struggle with this has been tantamount to the beginning of how it all started. And so sure enough, what do I have? We find out after our advanced training in the last year on ankle glossia, I have a posterior tongue tie. And so one of the many reasons I have severe sleep apnea is that. And so I'm not alone I'm finding now, we don't know for sure, it's very new, but more than 50% of my patients that have sleep apnea and airway problems at night also have a tongue problem.
Also, a lot of those people, I would say the vast majority, clench their teeth and have TMJ issues. And I know in your field, I'm sure that when a lot of people in your field are doing the treatments to fix, the jaw muscle in there, and it's always tying back up here. Yeah. And a lot of people don't think about the tongue tie as a part of that in terms of the connective tissue, what we call the fascia. Everybody, I speaking with a lot of people in your field and chiropractors, and we learn about the main trunk of fascia in your body, where the origin of all of your connective tissue comes from. Your tongue tie is right on that thing. And if that's restricted, all of the peripheral tissue around here, neck.
Explain where the frenum, explain where it connects.
So if you lift your tongue up, the little band of tissue that's right under your tongue, that's your frenum. That's where, if it's really restricted, that's where the tongue tie occurs. What you're looking at there is actually the anterior tongue tie, and that's the one that's out from your body. But people forget there's actually, if there's an anterior component, there's also a posterior component, and where that plays a role in all of this. And John talked about it here with sleep apnea, is it's going to control the back of your tongue. And if you go and you open your mouth open and closed a bunch of time and your tongue shoots to the back of your throat, you have a
we've got just to throw this in, we've got several of the retired Panthers that are patients. They're very holistically minded guys, actually, because they've been through a lot in their life. And so one of the guys, I mean, he's the gentle giant. He's 6'7". He's just this big beefy guy. And he came in for sleep problems originally, and he opens and he has the opening of like a little kid. And he's been telling us his whole life he's been dealing. Yeah. And so we did therapy, so to segue into back to TMJD, the disorder of the joint. So in this example, this guy had no opening, and you have three things at play. Dr. Eric hit on it. You have the fascia, which is the connective tissue that surrounds the muscle, which is the second thing, and then you have the bone, which, by the way, this is the most complicated joint in the entire body. If it was a single joint, a one hinge, we would be like an alligator, where we had to have a huge snout. Now look at what we eat. I'm a New Yorker. I mean, I can open my mouth, and both with the lungs and everything else. So you get back to this Panther guy. We're at the tail end of his treatment now. We've done all the optimization on the myofascial level, and also done some deprogramming with his joint, finding where that complicated joint wants to be. Because, by the way, we're also dealing with these anywhere between 24 and 32 stones of bone that are there, and how they line up. So it's multidisciplinary. It's not just about dentistry. It's what you guys do, and I'm really excited. What's really neat about where this is all going. This is fresh stuff. I mean, we're nationwide. I tell Eric all the time, this is leading edge, and where are we going to be as all of us collaborate? I don't know. Let's just go 5 years. Anything like that. Say 5.
I'd love to have somebody like you in my office. Like where I could send a patient there for pre-work and send them for post-work.
Absolutely.
But it is all tied together. And I know that at some point we actually do have a doctor coming in the next month that does specialize at Dr. Shelley Boucher, who is fantastic at TMJ treatment. But for those of you out there listening, I mean, I would just encourage that, again, TMJ stuff. Just if a dentist hands you a night guard, that's a Band-Aid. That's not fixing the problem. That's not getting to the root cause. You have to dig deeper into what the problem is.
People need night guards, but they need the night guard when the jaw's balanced. Right. If you've got slashing lines on it, and I hear this all the time. I chew through them. You were absolutely out of function, and I guarantee you are tongue-tied. I guarantee it, and that's where it's connected.
So that may be a life-changing topic right there. Yeah. So that's all someone walks away with. Yeah.
How do you, Doc? I'll be the host for a sec. What do you do about it?
So in our office, we do a laser tongue tie release. So we're using a CO2, what we call a cold laser. We use a laser from a company called Light Scalpel. It's a fantastic piece of equipment. But essentially, it's vaporizing. We vaporize the fibers in the tongue tie and the frenum. So there's minimal bleeding. Obviously, there's capillaries in there, so sometimes there's a little bit of bleeding. Usually, it stops about 2 minutes after we're done. But essentially, we take that rubber band and it just releases, and you'll typically have a little diamond-shaped wound underneath there. Pain is minimal because it's not cutting. It's just vaporization. Most patients that I've done this for, they report that it feels like they burnt the bottom of their tongue. Like if you bit a piece of pizza that's too hot and it got under your tongue, that's what it feels like for a couple of days. Generally, my 15, anywhere from 13 to 18-year-olds, those guys are bouncing back pretty quickly. And if you're in your 50s, it'll be a little bit more sore. But we encourage stretching afterwards. You have to keep the wound stretched. We don't want it to compress. As you know, if you get a cut on your arm, the skin is always super tight after it heals. The same concept applies for your tongue. We want you to stretch it out real good and to minimize the amount of healing compression that we have in the wound. So yeah, we use a laser release. If somebody's going to cut it, I would highly caution against that because you are not vaporizing the fibers. Their fibers are still there if you cut it, and if that tongue sits back on top of each other, those fibers are going to heal right back, and you're going to be
just like a cut on your hand. Yeah. Whereas when you vaporize it, I tell the kids, I'm like, this is like my Star Wars lightsaber that you can't even see.
So that's how we do it in our office. And I know there's other guys that use different lasers. We prefer the CO2 laser just because it is specialized for soft tissue.
Awesome.
Yep.
And we're not the only ones that do this. There's some great providers out there, even in our area. And I wish everybody did it because really in the future, that's what's needed.
Yeah. So you mentioned earlier about with TMJD and all those types of things the body is communicating to you that there's a problem, finding the root cause. How about root canals? And this is another like 5-hour podcast.
I think the 35,000 foot view on that, Sandra, is it's a deep topic. First off, as you're saying, and so we lecture on this. I've given several on this exact, and I say to anyone, there's the title is The Good, the Bad, and the Ugly. So I have to say first off, this is controversial. This is more the third rail of dentistry is maybe not Mercury. It might be this topic, and so there's an entire industry group of practitioners out there that this is their specialty. So I'm going to say this: none of us know. None of us 100% know. Now there was recently a movie that just came out on Netflix that had some very interesting information in it, that is based on someone's personal experience and what they've also found with some research, talking to some different health practitioners about root canals and its systemic risk. So I'm not going to ever sit here and deny that could be there, and it likely is. But again, back to like where we go, what we know on our end in the mouth is there is no way to make some of the anaerobic bacteria that we find in the body except when it starts here. So there's a correlation there with like even recent studies on breast cancer and what's cardiac disease, etc. So what do we? I think the safe topic, Sandra, without having an hour discussion on the background, is what do we really do about it? What do we do? And I tell patients it this way. Okay, teeth are organs, so we have 2 sets of them we're given. I don't even want it. It's 20 plus 32 if we get all of them. So normal people, probably 52 total. So along your lifespan, you lose these and you get a second set. We call them organs because they have their own life center. They all have their own nerve. And they're alive. And where else in the body do we leave dead organs?
So I don't think there's a single surgeon out there that looks at you when your appendix blows up and says, you know what we're going to do? We're going to pump that thing full of bleach, and then we're going to put a bunch of wax into it, and we're just going to let it hang out. So I don't think there's any surgeon on this planet that would go for that.
So we get into this focal infection theory. Is a chronic level infection in the jaw related to the rest of the body? I'll plug two books, Am I Dead by Fred Hughes, and also Saving Victoria's Breasts, which is about breast cancer, also by Fred Hughes, also co-authored by some other people that I don't remember their names. But Fred's a great guy. He's put his life towards, changing the paradigm, and he's a medical researcher. So, you want to talk research, this guy's, I'll just plug what he knows. And so on our end, we look at alternative options for dead teeth. When teeth die, the key elements to cover. We don't offer root canals in our practice. We do send you to a specialist if you do have a reason that you want to save it.
If you beg us, we'll send you to the
specialist.
specialist.
I'll give you a good example. Here's one. Okay, and I don't know for sure about this, about the very far out approach towards all root canals are bad. Okay, this is one I'll give an example of. You take a hit in the face, all right? You're 16 years old, and it cracks. A 16-year-old boy had this recently. Cracks at the gum line, front two teeth. Okay. Immediately that afternoon, you're in our office or in a specialist's office specifically that does root canals. And they take a traumatic approach to those teeth. Spec pulpotomy is what it's called, the different ways to save the teeth. Here's my belief. Those teeth should be saved for the short term. And I may be wrong, personal belief. And why? Because there was no necrosis in the bone at this point, and then you're going to monitor that kid for the next couple of years. And what's my point? A boy will grow until they're 21, 22. We start as the implant surgeon, I'll tell you, when we're starting to talk about putting in a white zirconia, a perfect implant, it's a lifetime restoration. I don't want to put it in at 16 and then have the patient have change. So there's ways we can, when there's infection, do something for a 16-year-old on that example. We try to save the teeth, but outside of that, or if the parents elect not to do it, well, then they're going with a removable denture for a while, or some basic form to get them through their formative years, and then get them to where they're keeps the girls away. So there's that. But overall, back to what's the big problem? There's a lot of patients out there right now that have chronic disease and even acute inflammation that it definitely could be related to dead teeth.
And so in a brief summary, how could that be possible for the person that would think, how in the world could my teeth make me have these type things? How would that process, knowing you work from here to here, how does that get from here to here?
Teeth have blood supplies in them, and even if you take the blood supply out in the sense of doing a root canal, there's still a blood supply that runs right below that tooth. If in the event that there's a secondary infection, which I believe that there's almost all of them have secondary infections, even the so-called healed ones. There is bacteria right near a blood vessel. That bacteria can get in your blood vessel, and there you go.
And it's anaerobic in nature. It hates oxygen. So it's down there in the bone. And then you get into Eastern medicine, you start talking about meridians in the body. And everything through the pathways from your brain, I believe this, go through your teeth and into different organs in the body. I'll go off, I don't have a literature on this, but I don't meet many men that have elevated prostate, PSA, or even prostate cancer history that don't have a dead tooth on their premaxilla from canine to canine on the top. And how many of us have had occasionally a little blow to the face back to that. So it's a fine line, and we have some great providers that are naturopathic physicians that I don't prefer working with patients that don't have some history. I love the internet, but we call it Dr. Google for a reason, because there's 75% good and maybe less, and so that's really the overview on that.
So on to the next topic, and we'll just hit this really quick because, like you've said before, which I love, is if it's not your scope of practice, you don't tell people what to do with it. But since this is an area of the body that my clients deal a lot with, in the methods that they choose to treat themselves, Botox for headaches and migraines.
It was a big thing amongst oral surgeons to actually offer that as a option in their practices for TMJ, especially. I even know my wife's uncle used to do it. I know he doesn't do it anymore. But Botox, you need to look and see what is Botox. Yes. It's botulism toxin. It's literally a toxin you're putting in there, and like most things, like most pain medications or opioids or things that are prescribed they're just prescribed to dampen the symptoms of things. Botox works because it'll last longer than most analgesics that you can get, like Tylenol, things like that. But it's not getting to the root of the problem. Really, and the reality is,
why is there the inflammation?
Right. You could take that or go get those injections to your heart's content, but it's never going to go away. And you need my advice would be to go find somebody that can get to the root cause of things and actually solve the problem, so there is no pain there. Same with us with opioids. If you're constantly on opioids, and you look at, I know we were talking before taping about the life expectancy of people in the U.S. dropping for 2 years consecutively, and a lot of it has to do with this opioid epidemic. I feel like what we're doing in our practice here is we're encouraging people and finding different modalities to decrease pain and not have to use those methods. And so Botox, in my opinion, kind of is just another masking.
It's effective.
It's effective for sure.
Inflammation. It works at. And I'll say, I'm a believer that if we're really, it's short-term result, it works. That's, I guess, the best summary. Right. But then my thought is, and why we don't do it is, we'll look at other ways. Now, I'll give you a good one. One of the things that I do with temporomandibular joint pain and discomfort, we have a modality, as Dr. Eric said, we're bringing in a lady, Dr. Shelley Boucher. She's starting this month, and she's a Dawson Academy graduate, which the Dawson Academy is one of the national groups that looks at the balance of the teeth and the overall symbiotic nature of the head and neck. And and I'm in another group, as I said, the Coy Center, that we're going to take these modalities and join them. Well, back to it. If you are looking for short-term results, even now what we're doing is we're injecting ozone into the joint. And I do that actually through the ear. You enter through right by the alar of the ear, and you can get into the joint space, and it can lower the inflammation in the joint. Now, there's a few things we do on the front end to make sure on the diagnostic level that this is not something that is surgical. So to briefly cover, there are definitely conditions that the only option for treatment is surgical. And I'll say that the most horrible story I've ever dealt with is before I knew anything about this as a young dentist, which unfortunately 95% of dentists have no clue about this because we're not taught about it in school. We're taught how to fill holes and do root canals and do prevention. They do talk a little on that. But I had a lady early on that committed suicide because of her jaw pain. Wow. And she wrote it in her suicide letter. And I'll share that because it hits home for me. And I think about her often because I really wish that, I had the knowledge that I have now on how to avoid it. And you know what? She would have been, back to it, the reason I tell this story, she would have been surgical. Right. We would have taken her through all the modalities to test and try. And then when it got to a point where we needed to do something, there are some incredible oral and maxillofacial surgeons out there that we work with that are holistically minded, and they are looking at minimization. And it puts us then when we can go back and balance teeth and put them in the right symbiotic nature back to that, what we find is people's pain goes away. 90% of migraines, temporal region migraines, are related somewhat to imbalance of the teeth.
It's clenching, yeah. That's almost all of it. But then it kind of, there you go, that answers your question about Botox. You don't really need it when you solve the problem there.
So what I want to point out and remind people is, and that's the tricky part, is they do feel relief. It's like, well, it worked. Right. But big picture, over your whole life and over your whole spectrum of health, what are all of the things you're putting in your body over a 10, 20, 30-year span of time? Some of them never go away. So that's another point I want to make, and this is why I'm throwing it out there. And when my clients ask me, should I do this thing? Should I try that? Well, if it has anything to do with holistic approach, I'm like, try all the things. Yeah. But if they're in an acute situation where their life is on the line, whatever, sometimes you do have to do these things. But big picture is find the why. That's the main crux of this conversation. And what you guys do is find the why to the communication, because pain is very simple. It's your body communicating to you that something is awry. Right. So if we just hide that with medicine or Botox or whatever, you never find the why. It is completely exacerbated within several years to the point that it could get that bad as taking your own life, which is back to my point of when you're in that much pain, you feel crazy.
Well, and you brought that up earlier, and I didn't get. We had so many wonderful things to talk about. We look at everything comprehensively. We want to look at the big picture. This is echoing what you're saying. There are acute scenarios where you need treatment. Sure. And so I always say to patients, one of my favorite things to do is when they come in and they're sitting there in pain and we can say hi and we can go through a little medical history quick. The first thing I want to do is I want to get them numb. Yeah. And comfortably numb where I don't hurt them. And the reason we do that is it then takes the pain away immediately. We can really spend time to get out of that level of lizard brain where you're taking action. And so I have a great friend, a holistic doc named Dr. Matt McAleese from the Charlotte Health Center, and he always says it this way. He came to me. I'll violate his HIPAA. He's a dear friend. He's like a brother, but he's a patient of ours. And he came in and he had some work he needed. And he said, and I was surprised because he said, well, I want nitrous oxide, personal decision, right? And there's people who believe I want nothing. Well, I asked him, I said, Dr. Matt, how could you say you want this, when it's going to be in your body? And he said, Doc, I do everything I can for my body to be my temple so that it's absolutely tip-top. I am really nervous because I'm concerned. I had a past history here, and I don't want there to be an anxiety event for me because that's worse for my system. My body will process it. It was just super cool because it made me realize, our bodies are amazing temples, and we're doing our best. It's so easy to get down and get, concerned about the overall what's out there. It's a scary world, and we just have to do our best to lower the inflammation in every way we can.
Everybody's different. That's the one thing I take and working here with my brother at our practice, I'm seeing how unique everybody's different situation is, from the people that need more anesthesia versus those that can go, I don't need it, just go ahead and drill my tooth. Everybody's different. But if you're in that acute situation, we can get you comfortable where you can make a logical, informed decision on your care.
Yeah, and that's exactly the point, is to let people know their options. You be the person that is garnering the power behind your health. Yep. Don't put it in someone else's hands. And that's what we're trying to tell people is there are plenty of options. Ask questions. Get your information. Ask questions.
Drive your own bus.
Yes,
That's
100%.
right.
We tell people all the time we're not in a rush. Acute, we want to make a move. But long term, we want to talk. And it's just about finding out, being that teacher.
So we're going to end this big conversation of things that could have spun off into a longer one. Yep. just the tip of the iceberg. And all of their information will be under the notes, and you can contact them. But on a personal level, so I have a lot of friends that are self-employed. My husband and I both are self-employed. So just give me a little bit of advice that you might have for the other dads that are self-employed, maintaining a family, maintaining a relationship. How does that look for you, finding that rhythm?
You need to make time for your family. Running a business and growing a business it can get exciting, and you get involved into doing it. But your life is a balance. One of my things I try to do every day is I always say, get home and cook dinner. Get home, be home for dinner, spend time with your family, make time for your family. You have a lot of hats that everybody wears every day. I wear a lot of hats in my own life. Dentist, dad, husband, son, brother, landscaper, contractor. I went through the list one time, and I think I had like 35 that I came up with. And you have to take a look at that list of hats that you wear and say, which one of these can I eliminate to maximize the dad hat or the husband hat? Those are the important things in life. So life's about balance. You have to schedule it out and make sure that you're giving time to people that are important in your life. The work's great. I love what I do. But there has to be a balance. That's the best advice I can give. And just being present. Being present for your family is the biggest thing for most people. Yeah.
I tell everyone that I had people that I was able to emulate, role models, my grandfathers, we're a close family even now. And so I always say to people, if I'm in my life, if I end up half the man that my grandparents were, my grandfathers and my dad, I won in life. And so there's, I tell people this because we're getting ready to do some really big things, and back to God, He's been there right with us, and I'm not leaving Concord. My brother's not leaving the Charlotte area, but we as a entity are going to be expanding beyond our walls. And our goal is to help as many people as we can and bring our brand there and build a big legacy, innocently. And so it's scary, and you have to go deep on the why. And for me personally, having Shannon as my rock and being there from the very beginning, I knew I wanted to be a dentist when I was 16, and I never knew I'd be a holistic dentist doing, doing some things outside the box, but God's got a plan, and so it truly is like Eric said, his is coming home for dinner. I've been, in my short time in my 10 years of dentistry, a traveler. I joke I'm like a band. I'm out on tour, and we pull a lot of continuing ed hours, and so the goal is, I want to, when I'm home, be present, and we're really even, and I'll say like the real summary on that is my family understands the goals. Like my best friend, like he said, next to Shannon's him, and also, my other buddies, we're going on a ski trip next week, and I really didn't want to go, but I got too much going on. I'm doing all this other stuff, and that bowl filling is huge because you need to be there and you need to serve everyone that water. And if it's empty, and your adrenals are out of whack, and you're not getting sleep, back to that, you're playing with a stacked deck. It's bad. So I've seen major change in my life as I've come there, and then last but not least, I'll go to, I got a Bible study I'm in with some neighbors that we do just about every Saturday. There are a lot of business guys too, and it's just nice to be able to, have that camaraderie and do it in the Word.
Mm-hmm. So that's a great way to end this. We're talking about teeth. We're talking about all these different things, but
such a great topic.
Comes back to big picture intention, being intentional and mindful about what we're doing with our body, mind, and spirit. And I think men get left out of that conversation, and I'm so glad you pointed that out. You guys need to be caring for your mental and emotional sides as well, and if not even more so. And so I'm glad you pointed that out. So as we continue on this journey of being relentless, I hope that you have picked up a few things that will help you. If you have any questions for Dr. Eric or Dr. John, their information will be below. But continue on your journey. It's your journey and yours alone. No one can live it for you. No one knows what it feels like. Only you. So only you can be the one that finds the answer, and that has to come from within. So that's a whole nother podcast, is why are we clenching our jaw in the first place?
Oh, yeah. Well, we'll get there.
So you're dealing with the physical, and then we get into the other side of it is the mental, emotional. But it's everything. You cannot. It's just like the Trinity. You can't separate it. We are body, mind, and spirit. You have to work on all components at all times. So continue on your effort to be relentless in your mental, emotional, and physical well-being. And Dr. John, Dr. Eric will help you do that. Thank you so much. Have a great day.